Go ahead, ma'am.
Good afternoon, everybody. I'm Dr. Devi. I'm the Clinical Head and Fertility Specialist at Oasis Fertility, Bangaluru. Today's live session is on the topic how to improve your success rates in an IVF procedure. So, many patients would have been advised to go ahead with an IVF procedure, and yes, it is an expensive procedure, it's a long procedure. So, everybody would want to do their best in terms of how to improve their own success rates. So, today's talk is to help you all with that. So, let me start with the most common question which is asked by a patient. What is the success rate of an IVF cycle? What is the reliable, reasonable success rate? So, this is not a blanket question to be answered with a blanket answer, because the success rate will differ from one patient to another, and also from one center to another, and similarly from one doctor to another. So overall, all over the world, wherever you go all over the world, the general success rates in an IVF procedure is around 40 to 50%. And in a very good prognosis case, like a very young couple with very less number of factors which requires an IVF, then it can go up to 60, 70 also in certain cases, I'm telling. Whereas in some cases where the couple is really old and multiple factors when it is there, it can go down to something as less as 25, 30 or even 40% as well. But overall, when you ask for a success rate in any good, reliable center with any trained doctor, the success rates can be quoted as around 50%. So there are certain things which the patients can do, and there are certain things which the doctor and the embryologist and the hospital can do to improve these success rates. We are trying to get into that. The most important factor which decides your success rate is the time at which you do your IVF. So, for example, and if an IVF has been advised to you by your doctor, please do it at the right time. The most common mistake, I would say, which many patients do is they would be advised to go for an IVF due to medical reasons. No doctor will advise an IVF unethically if there is no particular reason for it. So if an IVF is what is medically indicated for you as a couple, then the doctor would have told it to you. And if that has been told to you, please go ahead with an IVF procedure at the earliest, because these success rates which you are getting at this point of time, at this age, with these factors, may not be there many months or years down the lane. So do not wait. Going or getting into an IVF process at the right time is the most important factor which predicts and supports your success rates in any IVF cycle anywhere in the world. And choosing your hospital, choosing your doctor, everything is of at most important. So how will you choose the hospital or choose the doctor? Of course, we have Google to help us. We'll look at the Google reviews. You can ask patients who have taken treatment from that hospital or the doctor. The brand is important. For example, any good brand, like for example Oasis, in IVF would keep up the standards in the lab, in the OPDs, in the protocols. So choosing a good hospital or a good brand or a good doctor is important. A person who is specialized to do IVF will have a particular training in terms of a properly recognized degree in an IVF, and they would have good amount of experience in IVF. So choosing your hospital and doctor right by doing your own homework. Take time to do your homework to choose your hospital and the doctor. That is your first step towards taking your fertility journey. And coming to the hospital at the right time without delaying or wasting much time is of importance. Now, if, and as I told you, if an IVF has been advised to you, choosing that path, getting psychologically ready for that without much delay is of utmost importance. And of course, your doctors would have told you a few medicines to improve the quality of the eggs or the sperms or the general body conditions. Taking those medicines may not do wonders, but yes, it can marginally increase your success rates, and that marginal increase will translate to many important milestones in terms of getting a success in IVF. So whatever medicines have been advised to you, please take them properly at the right time. And we also do some additional investigations, tests, and procedures to prepare your body for an IVF procedure. So if any of those has been advised to you, please go ahead with that without much delay. Now, one important aspect of the IVF stimulation is getting your eggs out of the body, for which we will be giving you medicines. And those medicines are very, very important. Using a good quality medicine and maintaining a cold chain of that medicine, taking the injections properly is of utmost importance. There are certain people who prefer coming to the hospital to take those injections. So in any good hospital like this, these things will be taken care of. If you are taking your injections at home, then please make sure that the cold chain is maintained. You're using the right technique to take these injections and taking it at the same time every day. A few minutes or a few hours of buffer time is okay with a few injections here and there, which you can discuss with your doctor, and whatever is allowed within those limits, you can make deviations. Otherwise, take your injections properly, maintaining a cold chain and at the right time. So, and monitoring is also very, very important in an IVF in terms of doing scans. So frequent scans are really important. The way we monitor you in with scans and some blood tests. So frequent scans and blood tests is a part and parcel of a good monitoring, and a good monitoring is the key to getting a good quality egg out of your body. So please bear with us when we advise you frequent scans and blood tests, because that is very important. And once your eggs are ready, the injections, taking the eggs out through a smooth process, all that will be taken care of by your doctor. It is my headache. You can leave it to your doctor. And once the eggs and sperms are out, there are certain techniques which we do in the lab to improve your success rates. In terms of choosing the right egg, choosing the right sperms, there are certain techniques which are quite modern and which are widely in use these days by any good center to select out that best sperm, and putting one sperm into the egg, which is called an ICSI, which is needed in some people. So that is also going to improve your success rates in IVF. Now, growing these embryos in the lab. So the lab conditions is so important in deciding your success rate. That's why you choosing your brand right is very important. So an embryo which has grown in the lab properly, a good quality embryo that we are getting, half the job is done. So getting a good quality embryo is half the doctor's job, half the embryologist's job, and entirely the unit's job. So we work as a unit, a team. Every single person is important to make sure that you get a good quality embryo. Of course, your egg quality and the sperm quality is what decides the quality of the embryo. So at the end of the day, once an IVF is done, if we have two sets of embryos, good quality embryos, we would call it a good embryo, good IVF cycle, where we have material for at least two transfers. Suppose if one transfer fails, there is a backup. Then that is what is called a good IVF, which has a good success rate. In some scenarios, when the egg number is very low, when the sperm is really bad, you may not get two sets of embryos like this, or the embryo quality can be bad. In such scenarios, your doctor may advise you to go for one more retrieving of the eggs, one more cycle of IVF. This is sometimes called a pooling cycle in certain places. So if you have been advised to go through any of those things, it is simply to increase your success rate. So kindly consider making good quality embryos before going in for an embryo transfer. So once the embryos are ready, many times we put them back in 5 days after your egg has been picked up. There are some times where we do it after 3 days. So there is a third day embryo which is being transferred. There is a fifth day embryo which is being transferred. So if you compare a third day to a fifth day embryo, a fifth day embryo is any time a better quality embryo and a more robust embryo. Such an embryo has a better chance of giving you a pregnancy and a healthy baby. So if your doctor is advising you to go for a day 5 embryo culture, take it to day 5 and then transfer. This is called blastocyst culture. This is a very good step in the right direction. So please choose that if your doctor has told you to go for that. There are very rare scenarios in which we don't do this, when the number is very less or something like that. Sometimes we freeze these embryos on the third day and then transfer as a third day embryo, which has lesser success rates compared to a day 5 embryo. So, so the doctor will discuss what is the best for you. So please be open at any point of time to discuss your doubts and clear these things with your doctor, and be an active participant in the decision making where your embryos are getting formed and transferred to you. So when we transfer as a fresh embryo transfer, that is immediately after your eggs have been picked up, 5th day or 3rd day, we just put them back in. That's called a fresh embryo transfer. There is something called a frozen embryo transfer, where we freeze these embryos, give you a gap of a month, and then we prepare your lining using some tablet. The womb has been prepared for an embryo transfer using some medicines, and then we put these embryos back in. That's called a frozen embryo transfer. By and large, frozen embryo transfer has a better success rates in most of the people, but there are some exceptions here. In some people, fresh transfer has equal success rates as a frozen embryo transfer. In some scenarios, frozen embryo transfer is better. So that would be advised to you by your doctor. Accordingly, you can go ahead with the fresh or the frozen embryo transfer. What works best for you can be decided in discussion with your doctor. Now, if you are going for a frozen embryo transfer, you will get a gap of a month usually. Please utilize this time for your weight, in terms of reducing your weight, getting the best, being at your best self in terms of your mental status. Everything is important. So stress levels can have an implication on your pregnancy rates. Your weight can have an implication on your pregnancy rate. So utilize this time to optimize your health. For a egg pickup, many a times the ideal weight loss need not be there, but at least by the time you transfer these embryos back to you, you should have reached your at least close to your ideal weight. So keeping in touch and closely following up with a good dietitian will do lots of wonders. And being in an active lifestyle in terms of regular exercise and whatever you can do to de-stress yourself, like meditation, yoga, de-stressing therapies, whatever you can think of, what works the best for you, be at your best self possible when you come for your embryo transfer. Now, in embryo transfer also, we prepare the lining of your womb, the bag of your womb, to receive this baby by doing some scans and putting you on some medicines. Here also, frequent follow-up is extremely important. So kindly bear with us when we tell you to come for 4 or 5 scans in a period of 15-20 days. And there are certain things which we have to do from our end as doctors to make sure that you get that best lining, in terms of monitoring you properly, adjusting the doses of your medicines properly. And there are lots of Doppler studies, blood flow studies. Is the blood flow from the body to your womb good enough to support a baby and a pregnancy subsequently? And is the ultrasound parameters which we check for very optimal before we go in for an embryo transfer? These are things which your doctor should be doing, which any good doctor, trained doctor would do. So if things are not going fine, sometimes your doctors tell to cancel embryo transfer cycles. So if that happens, please do not fight back. Please listen to them. Would be a reason why they would be suggesting a cancellation of an embryo transfer cycle when the lining is not optimal. So if something has been told like that by your doctor, please abide by what they are saying. Only when the lining is perfectly ready, you go ahead with an embryo transfer. Now, in an embryo transfer also, many a times we would prepare you by doing something called a mock embryo transfer, where we actually put an empty catheter in to see if the path is smooth. If it is not, then there are corrective procedures by which we make it smoother. There are certain procedures called hysteroscopies. This is not needed for all, but for some people it is needed. It is something as simple as a small camera being put into your womb to see what is there inside before you go ahead with an embryo transfer. Sometimes we see some masses sitting there, some partition sitting there. This is the area where the embryo is going to come and try to attach. So if there is something there, it is better to remove that by putting a camera. This is called hysteroscopy, and then preparing you for an embryo transfer. This procedure, if really needed, will be done for you. And if it is done, it will increase your success rates by heaps and bounds, if really needed and done properly. So that is there. And embryo transfer and mock embryo transfer before the actual embryo transfer, and making the path smooth if needed, and a very smooth transfer of the embryos under an ultrasound guidance by a trained fertility specialist is the best thing which you can do for getting a best success rate. Now, there is a question of how many embryos to transfer. 1 embryo, 2 embryo, 3 embryos. So if you have 2 good quality day 5 embryos, in some people we can transfer 1, in some people we can transfer 2. If I have an embryo A and an embryo B, the embryo A is not going to increase or decrease the chances of embryo B getting implanted, and vice versa. So in some scenarios, when the woman is older, multiple factors are there. To increase the chances, we might suggest to putting 2 embryos in. Yes, by doing this, the chances of twin pregnancies also increase. Whereas in a very young patient, we could decide to go ahead with transferring 1 embryo, which may give you as good a pregnancy rate as 2 embryos would have given you. So depending on your body status, your profile, discuss with your doctor as to whether you want to transfer 1 or 2 embryos. There is no doubt 2 embryos will increase the chance, because if 1 embryo doesn't implant, probably the other one will implant. But in good prognosis cases, this increases chances of multiple pregnancies, twins, etc., which is again a risk factor in a pregnancy. Now, there are certain points like immunity. Suppose if a patient's immunity is abnormal, this may not allow a baby to attach. This is particularly important in scenarios where people have gone through multiple embryo transfers and failed, etc. In such scenarios, your doctor may check these levels in the blood or in the body, and then they may suggest some medicines to you in terms of tablets for 3 months, 4 months, injections during the embryo transfer time. These kind of therapies, immunomodulatory therapies, or some tablets or injections additionally given to you during your embryo transfer, might be suggested by your doctor to improve your success rates based on your profile. This is not for all, but it is only for selective indicated cases. Now, after the embryo transfer also, what can you do from your end? Again, be at your best self and your best relaxed self after your embryo transfer. Absolute bed rest is not really needed at all. Unnecessary travel and activities can be avoided. You can have all the activities in a milder form. There are many patients who travel immediately after the embryo transfer also. We have excellent success rates with those embryo transfers as well. So absolute bed rest is not really needed, but slowing down one pitch level on your activities is what expected out of you, and taking your medicines properly with the right technique on time, and staying relaxed. Staying neutral is what is better, rather than staying too positive or too negative. Just stay neutral, be ready for both the outcomes. And regarding diet, exercise, your doctor will take you through in detail about diet and exercise. There are certain types of diets which we might tell you to avoid. There are certain fruits which may increase the uterus contractions and make it very, very angry kind of an environment. We may tell you to avoid those. That's all. And regular activity, whatever is usual to your body, can be followed. But do not start any new kind of an activity in this period in terms of physical activity and exercise. So these are some of the steps which you can adapt to and adopt in your IVF journey to improve your success rates. And in some cases where there have been failures, there are advanced techniques available, like testing the embryo genetically, testing your lining genetically, using lots of immunomodulation therapies and treatments. These are all for patients who have not conceived with 1 or 2 embryo transfers, mainly for failed cases. And in some indicated cases where the couple is quite old or severe factors are there which is contributing to the fertility problem as such. Apart from that, this is in general about how to improve your success rates in an IVF procedure. I hope this video has been useful to all the couples out there who are trying to complete their dream family. If you have any questions, please type in the comments box below. I would be happy to take up a few questions and answer them at my level best of ability. Good luck to all of you who are trying out there. Good luck and goodbye. So if there are any questions, I will take them now. So I have one question coming up here. How can I increase my chance of IVF implantation? So this is what we have taken up in detail. Getting a good quality embryo is the key to getting a good implantation, because many a times why implantation doesn't happen is the reason it's that embryo itself may not have a good genetic material. So doing an egg pickup until we are getting that good quality embryo, there is a genetic which is available. Good quality embryo plus or minus a genetic testing of the embryo or the lining, taking the medicines properly, monitoring properly throughout the cycle to get the best lining possible and the smoothest transfer ever possible, and taking your medicines on time after the embryo transfer, and being at your best self in terms of mental, physical well-being and health during the endometrial preparation, after the embryo transfer is the key. What should I eat? Okay, that's a very common question which is asked about what should I eat for a successful IVF. See, anything in excess or anything too little is not good. So you can have everything in moderation. But by and large, we don't need many simple carbohydrates like rice, wheat, atta, maida, rava. You can cut down on those. There should be a good amount of vegetable intake per meal. There should be at least a fist size of protein per meal. This is the thumb rule. And sugars can be cut down to bare minimum or nil. Sweets only in the form of fruits, 1 or 2 seasonal fruits per day is good. And at least 2 liters of water per day. And you can avoid all unhealthy items like trans fats, deep fried items, and normal amount of oil and normal amount of spices fine. Papaya and pineapple is something which we many of the fertility specialists tell you to avoid, because papaya has papain, a compound called papain, and pineapple has a compound called bromelain. These are actually increasing the uterus action. There are no huge evidences for this, but yes, these are 2 things which we tell you to avoid. Apart from that, you can have everything healthy in moderation. I'll take the next question. Yeah. What foods should you avoid during IVF? Yes, as I told, papaya and pineapple can be avoided. Anything too unhealthy, deep fried items, too much of oil can be avoided. And if you have experienced lots of bowel movements with any particular kind of food, many people tell moringa leaves are not suiting me. So those kind of things you can avoid immediately after, maybe a week or so after your embryo transfer. Apart from that, you can have everything. Too much of sugars is an absolute no-no. And unhealthy food basically is an absolute no. How can I make IVF easier? See, previously IVF was so tough for many years back. You wouldn't believe it. It was much, much tougher than how it is right now. But right now, IVF has actually been made easier because of the patient-friendly injections and patient-friendly protocols, where much simpler injections are available, and lesser number of scans, and frozen embryo transfer which can be scheduled. So already IVF is made easier, but you having a good treatment plan discussed with your doctor is of utmost importance. So your doctor should know what your job is, what your job timings are, how your scheduled appointments and your scans are going to be, what is your injection times going to be. So that will make those 10-11 days of injections during IVF that itself easier. And the procedures are actually quite easy. We give you sedation when we take the eggs out, and that can reduce the pain and other things. So there is not much pain in IVF at all, I would say. And embryo transfer cycles also, it can be pretty much straightforward and scheduled. So taking your appointments and scans at the right time, in discussion with your doctor, and taking your medicines properly, and after the embryo transfer, keeping yourself fit and healthy. These are the things which you could do to make IVF. Of course, if you at any point of time, if you need help, talk to your doctor, talk to a therapist. All the help is out there. You just have to ask for it. That's it. Have a clear communication with your doctor. Be an active participant in your treatment plan. That will do the job. Another question is there, which is, why does IVF fail the first time? Again, there is a 50% chance your IVF may fail the first time. And most of the time, the reason why that happens is the embryo itself. For example, if that embryo did not have a good genetic material, whatever we do, it will not attach and grow. And many a times it may attach and start growing, and it may stop its growth at some point of time down the lane in the first 5 months, more so in the first 3 months. So that embryo itself, if it is of abnormal genetic material, like nature has its own way, it will not allow it to grow, or it may make it go away in the first few months itself. Another reason why it doesn't happen, that your lining was probably not ready to receive that baby when we had put these embryos back in. So if there are ways of testing it, if it was like that, it is through a genetic testing that can be done. There are certain factors where immunology can play a role. So a baby is like a foreign material. It's like a parasite which is trying to grow in a mother's womb. So when that baby grows, the mother's immune system should be so ready to accept that foreign body or a parasite. So if it is not, there are ways of finding out, and there are ways of modifying or modulating your immunity to that level where it is ready to accept that baby. So by doing that also, we can get a better outcome the next time. So first and foremost, you have to evaluate why it happened, see the embryo quality, see the lining, and see the overall health and the immunity and the other factors, and solving the problems which we are anticipating. For example, if the baby was itself abnormal, you are suspecting a genetically abnormal embryo, you test the embryo for genetics. You are suspecting the lining to be not at its best receptive state, you test the lining. You suspect the immunity to be bad, modify it. So by doing these simple measures, we can get a better outcome the next time. So with this, we are coming to a conclusion. So I hope this video was helpful to all of you. Thanks a lot for listening to this. All the best to all the couples who are trying for their dream baby. All the best. Thank you.